Anemia. It's a word you've probably heard, but do you really know what it means? Anemia is more than just a medical term. It's a condition that can affect your daily life in ways you might not realize. In simple terms, anemia is a condition where your body doesn't have enough healthy red blood cells. These cells are crucial because they carry oxygen throughout your body, giving you energy and keeping your organs functioning properly. Without enough of them, your body struggles to perform even basic functions. Think of it like this. Imagine your body as a bustling city, and red blood cells are the delivery trucks. They transport vital supplies, in this case oxygen, to every corner of the metropolis. When these deliveries are delayed or insufficient, the entire system starts to falter. When there aren't enough trucks, deliveries slow down, and the city starts to suffer. This is what happens in your body when you have anemia. Anemia is a surprisingly common condition, affecting millions of people worldwide. It's not just a problem in developing countries, it's prevalent everywhere. It can affect anyone, regardless of age, gender, or ethnicity. From children to the elderly, no one is immune. While it's often a silent condition, meaning it doesn't always cause noticeable symptoms, it can have a significant impact on your health and well-being if left untreated. Fatigue, weakness, and shortness of breath are just a few of the signs. In this exploration of anemia, we'll delve into the different types, uncover their symptoms, and understand the underlying causes. We'll also discuss how this often overlooked condition is diagnosed and treated, and what you can do to manage or prevent it. Stay tuned as we uncover the silent epidemic of anemia. Iron deficiency anemia is the most prevalent type of anemia worldwide. It occurs when your body lacks sufficient iron to produce a protein called hemoglobin, which is essential for red blood cells to carry oxygen. Iron is like the engine oil for those delivery trucks we talked about earlier. Without enough iron, the trucks can't run efficiently, and oxygen delivery is compromised. Several factors can lead to iron deficiency, including inadequate iron intake. Not consuming enough iron-rich foods such as red meat, leafy greens, and beans can lead to a deficiency. Blood loss. Conditions like heavy menstrual periods, ulcers, or gastrointestinal bleeding can result in significant blood loss and therefore, iron loss. Pregnancy. During pregnancy, a woman's iron requirements increase to support the growing fetus, making them more susceptible to iron deficiency. Iron deficiency anemia can often be corrected with iron supplements and dietary modifications. Just like your car needs more than just fuel to run smoothly, it requires oil, coolant, and other fluids to function optimally. Your body needs more than just iron to produce healthy red blood cells. Iron is essential, but it's not the only player in the game. Certain vitamins, particularly vitamin B12 and folate, also known as folic acid, are crucial for red blood cell production. These vitamins work together with iron to ensure that your blood cells are healthy and functioning properly. When your body is deficient in these vitamins, it can lead to vitamin deficiency anemia. This condition can cause symptoms like fatigue, weakness, and shortness of breath. Vitamin B12 is found in animal products like meat, poultry, and dairy. These foods are rich sources of B12, making them essential for those who consume animal products. While folate is abundant in leafy greens, citrus fruits, and beans. Including these foods in your diet can help maintain adequate folate levels. Certain factors can increase your risk of developing vitamin deficiency anemia. These include dietary choices, medical conditions, and even certain medications. Dietary restrictions. Vegans and vegetarians are at an increased risk of vitamin B12 deficiency if they don't consume fortified foods or supplements. It's important for those following plant-based diets to be mindful of their B12 intake. Malabsorption disorders. Conditions like celiac disease or Crohn's disease can interfere with your body's ability to absorb nutrients, including vitamin B12 and folate. These conditions require careful management to ensure proper nutrient absorption. Medications. Certain medications, such as those used to treat seizures or stomach acid, can interfere with vitamin absorption. Always consult with your healthcare provider about the potential side effects of your medications. Addressing vitamin deficiency anemia typically involves dietary changes and supplements to replenish the missing vitamins. By making these adjustments, you can help restore your body's balance and improve your overall health. Unlike iron deficiency and vitamin deficiency anemia, sickle cell anemia is an inherited blood disorder. It's characterized by an abnormality in the hemoglobin protein, causing red blood cells to become rigid and sickle-shaped. Imagine these sickle-shaped cells trying to navigate through your blood vessels. They can get stuck, blocking blood flow and causing pain and damage to organs. Sickle cell anemia is a lifelong condition, and its severity can vary widely among individuals. While there's no cure, treatments focus on managing symptoms, preventing complications, and improving quality of life. Medications, blood transfusions, and bone marrow transplants are some of the treatment options available for sickle cell anemia. Section 5. Other types of anemia, a broad spectrum. Iron deficiency, vitamin deficiency, and sickle cell anemia are just a few examples of a wide range of anemia types. Other types include aplastic anemia, which is a rare but serious condition. This occurs when your bone marrow doesn't produce enough red blood cells, often due to an autoimmune disorder, infection, or exposure to toxins. Then there's hemolytic anemia. In this type, red blood cells are destroyed prematurely, often due to an autoimmune disorder, infection, or certain medications. And let's not forget thalassemia. This inherited blood disorder affects the production of hemoglobin, leading to mild to severe anemia. Each type of anemia has its own set of causes, symptoms, and treatment approaches. Section 6. Recognizing the symptoms. Is your body trying to tell you something? Anemia often develops gradually, and its symptoms can be subtle, especially in the early stages. This means that many people might not even realize they have it until the symptoms become more pronounced. However, as the condition progresses, you may experience a range of symptoms that can significantly impact your daily life and overall well-being. Fatigue. Feeling constantly tired, even after adequate rest, is a common symptom of anemia. This fatigue can affect your ability to perform everyday tasks and reduce your overall productivity. Weakness. Generalized weakness and lack of energy are also typical. This can make it difficult to engage in physical activities or even simple movements. Shortness of breath. Because your body isn't getting enough oxygen, you may experience shortness of breath, especially during physical activity. This can be particularly noticeable when climbing stairs or exercising. Pale skin. The lack of hemoglobin, which gives blood its red color, can make your skin appear pale. This pallor is often most noticeable in the face, palms, and nail beds. Dizziness. Reduced oxygen to the brain can cause dizziness or lightheadedness. This can lead to a feeling of unsteadiness or even fainting in severe cases. Other symptoms can include headaches, cold hands and feet, chest pain, and an irregular heartbeat. These symptoms can vary in intensity and may come and go. It's important to note that these symptoms can also be indicative of other health conditions, so it's crucial to consult with your doctor for a proper diagnosis. Early detection and treatment can make a significant difference in managing anemia and improving your quality of life. Section 7. Diagnosing anemia, unmasking the hidden deficiency. Diagnosing anemia typically involves a combination of a physical exam and blood tests. During the physical exam, your doctor will ask about your medical history, symptoms, and dietary habits. They will also check for physical signs of anemia such as pale skin, rapid heart rate, or an enlarged spleen. Blood tests are crucial for confirming the diagnosis and determining the type of anemia. The most common blood test is a complete blood count, which measures the number of red blood cells, white blood cells, and platelets in your blood. Other blood tests, such as iron studies, vitamin B12 levels, and folate levels, may be ordered to identify the underlying cause of anemia. Early diagnosis and treatment are essential for preventing complications and improving outcomes. Section 8. Treatment options. Replenishing your body's resources. The treatment for anemia depends on the underlying cause, severity, and your overall health. Iron deficiency anemia. Treatment usually involves iron supplements to replenish iron stores and dietary changes to increase iron intake. Vitamin deficiency anemia. Supplements of vitamin B12, folate, or both are typically prescribed, along with dietary modifications to address the deficiency. Sickle cell anemia. Treatment focuses on managing symptoms, preventing complications, and improving quality of life through medications, blood transfusions, and in some cases, bone marrow transplants. Other types of anemia may require different treatment approaches, such as medications to suppress the immune system in cases of autoimmune hemolytic anemia or blood transfusions to replace lost red blood cells in cases of aplastic anemia. It's important to follow your doctor's recommendations for treatment and to attend regular follow-up appointments to monitor your condition. Section 9. Conclusion. taking charge of your health. Anemia is a common but often overlooked condition that can have a significant impact on your health and well-being. By understanding the different types of anemia, their symptoms, and the importance of early diagnosis and treatment, you can take charge of your health and prevent potential complications. Remember, if you experience any of the symptoms mentioned earlier, don't hesitate to consult with your doctor. Early detection and treatment are key to restoring your body's balance and ensuring you live a healthy and vibrant life.